So this is just diagnosis and treatments. What we tend to do at our office is we actually look at the fact that there are 3 different cell types. So we look at cell wall type, cystic, intracellular. We tend to, depending on how severe the situation is, some people may be treated with 3 different antibiotics, some people just 2, and depending on how your symptoms are, 1 may be okay, but we tend to monitor symptoms very often, typically every 2 weeks, especially when you're undergoing active treatment. Which infections are present? Can I cover more than 1 pathogen with the antibiotic regimen? And will the regimen cover the spiral L form, cystic forms, and will they penetrate into the tissues of the joints, or if they're localized in the brain? And if we see people that had been treated, were they treated appropriately? What are the other potential problems? Informing people that yes, you may and most likely get worse after you get better. And that is the Herxheimer effect. And the Herxheimer effect was actually found out during the treatment of syphilis, right? Sounds familiar. Spirochete, syphilis. When people were first treated with penicillin, they noted that in 2 to 3 days, they got significantly worse. Their symptoms got worse. If they had a headache before, they have a worse headache now. If they had joint pain before, they're worse now. If they had a little bit of a rash, it was worse. So you have to look at whether these are side effects of the medication or the fact that this is a Herxheimer reaction. Lab testing is difficult. There are many variants. Borrelia Miyamotoi is a new Borrelia that is not detected by the conventional Western blot. It came from Japan. It was written up by a doc out in Boston, an elderly woman who came with a sudden onset of dementia, fever, neck pain, and it was only the good fortune of the doc who, when they drew her spinal fluid, they sent out for this Borrelia Miyamotoi culture. They adapt to changing environments. They change over time. They contain large amounts of highly complex genetic material that affect you and your immune response. So the culture test is kind of the new culture test that's been around for about 1.5 years now. Unfortunately, the major problem with it is that it's very expensive and it's not available in New York State. It is available in every other state, and only because we have a practice in Vermont are we able to have patients get this test. It can be used for diagnosis, and the CDC does recognize it if it's positive to have a positive culture. You have to be off antibiotics for a minimum of 4 weeks. Some recommend 6. It's peripheral blood only, so if it's not in your blood, it may not be detected, even if you have it. You need a large volume. And the reason why it's an effective culture, and it's sort of unknown what culture medium they use, but they use a special culture medium. Typically, if you've had chronic disease and you're having these waxing and waning symptoms, the likelihood of you having a high titer of the bacteria in your blood is pretty low. And the reason why they have a better result with their testing is because they keep it for a minimum of 10 weeks in culture, which is highly unusual. Most cultures, they'll keep for at most 10 days. The accuracy seems pretty good. The sensitivity in 1 week is not great, or 10 days. Their report is 47%. Our experience is it's probably less than that. We actually, I think, have only had 2 positive results in one week or 10 days, and the other positive results, and we've had about 2 dozen. typically after 8 to 10 weeks. And then if you keep it for an additional 16 weeks, it's about 94% sensitivity. The positive fact is that there's no false negatives. CD57 count is another way of looking for immune function. I'm going to kind of skip over this. Persistent infection, more antibiotics. Is this an autoimmune response? Is this a hyperinflammatory response? Not getting better? Is this Herxheimer reactions? Do you have a yeast infection? And these are all continuing questions which honestly, if all of us, including infectious disease docs, rheumatologists, all could kind of buy into this concept, we could all use their help. We could understand maybe better on how to approach all these different issues. HLA-DR4 is something that I had mentioned briefly just in the beginning, which is this is a test to see for those people that really are not improving. And it's a human leukocyte antigen which helps the body distinguish proteins from itself versus viruses and bacteria. And this is a way for us to tell, well, if you have this gene, then you may be having a more difficult time getting better. I think I'm going to end it here and let you kind of write your questions